Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Glomerular diseases, and you're looking at the sites of deposits. So the first site we'll be looking at is the subepithelium. So here in the subepithelium. So in subepithelial, we'll include the membranous nephropathy. So this includes the membranous nephropathy. So there is something known as the membranous nephropathy, and this is the epimembranous. It is the epimembranous. Next is the presence of the PSGN. So all these are subepithelial. So PSGN as well as the membranous nephropathy. Next is the intramembranous. So we look at the intramembranous. So intramembranous, there is a dense deposit of the disease. So there is a dense deposit. So dense deposit of the disease, and this is nothing but the MPGN type 2. So it is the MPGN type 2. Next, we look at the subendothelium. So there is presence of the subendothelium. So subendothelial, it includes the MPGN type 1. So previously in intramembranous, we saw the MPGN type 2. Here it will be the MPGN type 1. MPGN T1. And also the subendothelial, it includes the lupus nephritis. So we're writing it as LN. So this will include the class 3 as well as the class 4. Next is we look at the mesangial. So in terms of mesangial, this will include the IgA nephropathy. So IgA nephropathy, and there is also the HS purpura. So there is the HS purpura. Next is the RPGN. There is RPGN and the lupus nephritis, that is class 1 as well as the class 2. Then comes the resolving post-infectious glomerulonephritis. So there is presence of the resolving post-infectious glomerulonephritis. Then lastly, we look at the presence of node deposits. So the node deposits, if you see, it includes the minimal change diseases. So in case of node deposits, they will include the minimal change deposits, as well as it includes the FSGS, focal segmental glomerulosclerosis, as well as the Alport syndrome. So the Alport syndrome is also included. To learn and grow daily like this, please do subscribe.